Good day, ma'am. I'm Rachel May M. Morales, BSN 2 Section A from Negros Oriental State University. So for today, I'm going to perform PO or per oral medication administration. So for our assessment, we're going to assess for any contraindications to client receiving oral medication. So is the client able to swallow? Is the client suffering from nausea or vomiting? Is the client diagnosed as having bowel inflammation or reduced peristalsis? Has client had recent GI surgery, or does client have gastric suction? So we're going to check the client's swallow, cough, and gag reflexes if in doubt about the client's ability to manage oral medications, and withhold medications if swallow or gag is impaired, and notify physician. Okay, so we're going to check. Okay, so the client can be able to swallow medications orally. Next is we're going to assess client's medical history, history of allergies, medication history, and diet history. Okay, so it says here that the client is experiencing discomfort caused by headache, and the client is also experiencing heart failure and opioid dependence or addiction. Next is we're going to gather physical examination or laboratory data that may influence medication administration. And then we're going to assess client's knowledge regarding health and medication use. And then we're going to assess client's preference for fluids. Now let's move to our planning. So first, we're going to wash our hands. So we're just going to use a rubbing alcohol and do hand hygiene. Okay. And then we're going to obtain necessary equipment to save time and reduce error. So here are our equipments. So we have here our mortar and pestle, BP apparatus and stethoscope, thermometer, clean gloves, alcohol, medications, medication cup, dropper, syringe, medication card or tickets, physician order sheet, patient's chart, MAR or medication administration record, and calculator to double check medication dosages. And then we're going to prepare medications for one client at a time. Then we're going to select correct medication at the client's medication cabinet. Then we're going to compare label of medication with medication card. Okay, so paracetamol by Jessic, 500 milligrams tablet. Okay, right. For sublingual, okay, so we have here captopril, 25 milligrams. Right? Then, Bunavail, we have here 4.2 milligrams per 0.7 milligrams. Okay, so this is by Bucal. So, right, correct medications. So we also have here our syrup for purposes later. And then we're going to calculate medication dose, then we're going to double check calculation. To prepare tablets or capsules from a stacked bottle, we're going to put required number into bottle cup and transfer medication to medication cup. So we should not touch the medication with our fingers. Okay. The extra tablets or capsules may be returned to bottle. Okay, so we only need one tablet of paracetamol. Then we're going to place it in the medication cup. So for sublingual, Bucal, and there are medications that need to be broken, so we're going to use our gloved hand. Okay, so I'm just going to show you on how to crush a tablet using mortar and pestle. This is only a sample on how to crush a medication using a mortar and pestle. Okay. Okay, so now the tablet is now in a powdered form. After crushing the tablet, we're going to place it in a medication cup. Then we're going to put some water in it. Okay. So tablets that are to be broken in half must be prescored. So prescored tablets are identified by manufactured line that transverses the center of the tablet. So this is an example of a prescored tablet. So it has a line in the center. And to prepare unit dose tablets or capsules, so we're just going to place back tablet or capsule directly into medicine cup. So we already place our medications on the medication cup. And all tablets or capsules to be given to clients at the same time may be placed in one medicine cup, except for those requiring pre-administration assessments, such as pulse rate or blood pressure, as well as the respiratory rate. If the client has difficulty swallowing, then we're going to ask a physician to substitute with liquid. And if liquid medication are not an option, then we're going to use a pill crushing device such as mortar and pestle. And if pill crushing device is not available, then we're going to place tablet between two medication cups. Then we're going to grind with a blunt instrument. Here, then an instrument. So we're going to note that not all medications can be crushed, such as capsules or intercoated drugs. So we're going to consult pharmacists when in doubt. So now we're going to prepare liquid. But first, we're going to check the expiration date. Okay, so we have here October 23. Then we're going to remove bottle cap from container. We're going to place cap upside down. Then we're going to hold bottle with label against our palm of hand while pouring, and hold medication cup at eye level. Then we're going to fill to desired level of scale. And scale should be even with fluid level at its surface or base of meniscus and not on edges. Okay, so we're going to pour 5 ml. Okay. So that's 5 ml. Then we're going to cover it again. Okay. So we're going to check expiration date on all medications. So for Biogesic, okay, so 2024. Captopril, so it will be expired on May 2023. Bonavail, September 2024. Next is we're going to compare medication card with medication and container. So for paracetamol, okay, Biogesic, right? Captopril. So we're just going to check it. Okay, Bonavail, right? So everything's correct. Then we're going to return stock containers or unit dose medications to shelf or drawer. Then we're going to read the label again. Okay, so paracetamol, captopril, and Bunavil. So we must not leave the medications unattended. So now we're going to administer medications. So we're going to take medications to client at correct time. Let's go. This is Rachel May Morales, your student nurse for today.
Yes, come in.
Good morning, sir.
Good morning.
So, may buntag usab, sir. Ako si Rachel May Morales, ang imong nurse karon. Pwede ba na ko i-check imong bracelet, sir? Sa ito nga lang, sir.
Jacqueline Morales.
Kaya saan ka gipanganak, sir?
March 7, 2014.
Okay, very good. Next, we're going to explain purpose of each medication and its action to client. Then we're going to allow client to ask questions about drugs. O karon sir, time naman nimo sir para mainom sa imong tambal sir. So karon sir, nako gipangdala diri nga tambal, tulo ka book ni siya sir, which is prescribed sa doctor sir. Ang una natong tambal sir mao ang paracetamol biogesic, so para ni siya sa imong fever sir. Ang mga side effects ani niya sir mao ang pwede ka maghipong, muhalap ang panglantaw, kapuyon, maglain ang tiyan. Ang atong ikaduha nga tambal sir mao ang captopril.
Para unsa na?
So, kaning captopril, sir, para din siya mag-ayo sa imong heart failure o iyang iparelax, sir, ang imong ugat o mga blood vessels, sir, para ang imong dugo, sir, sayon lang ang ilang pag-flow. So, kaning captopril, sir, imo ni siyang imnon pinaagi sa pagbutang ani sa lalam sa imong dila, sir, kutob sa malanay ni siya. So, dili ni siya pwede nimong usapon, sir. Ang atong ikatulong tambal, sir, mao ang Bunavil. So, kani siya, sir, imo ni siya ibutang sa tunga sa imong aping, sir, kutob sa malanay ug dili gyapon ni siya nimo dapat usapon. So kaning Bunavil sir para ni siya mag-treat sa opioid addiction nimo sir. So before na nako ihatag ang tambal nimo sir, ato sang i-check imong blood pressure sir, imong respiratory rate ug imong pulse rate sir. Imong BP sir 70/60. Check the same pulse rate, sir. Imong PR, sir, or pulse rate, 72. Ang imong respiratory rate, sir. So, ginhawa lang, sir. Okay, so imong respiratory rate, sir, 20 CPM. After doing the pre-administering assessments, we're going to assist client in sitting position. So, kaya ra ba nimo molingkod, sir?
Of course.
Okay, umikot ka, sir. Okay. Okay. So now we're going to administer medications properly. So client may wish to hold solid medications in hand or cup before placing in mouth. Then we're going to offer water to help clients swallow medication. So muna siya ang biogesic, sir. So, sir. Okay, yung tubig, sir. Okay, so, pwede natin i-check, sir. Okay, very good. So, for sublingual administered medications, we're going to have client place medication under tongue and allow medication to dissolve completely. Then, we're going to caution client against swallowing the medication. So, we're going to wear clean gloves. Okay, butang pili. So, pwede ka mabangan na, sir. Okay. So, yan na lang, sir. Di malanay rin siya, sir, ha? Ayaw usapa, sir, ha? So, pwede na to i-check, sir. Tapos nila, okay, very good. Okay, so we're going to sanitize your hand first, sir. And for buccally administered drugs, we're going to have client place medication in mouth against mucous membrane of the cheek until it dissolves. And we're going to avoid administering liquid until buccal medication has dissolved. So, muna atong ikatulong tambal, sir. So, kanis siya, sir. Imo ni siya ibutang, sir, sa kaning sa imong aping, sir. Putob ni siya malanay, sir. So, ayaw lang ni usapa, sir, ha? Or ayaw lang tulad rin siya, sir, ha? Okay. Good. Okay, so pwede na to i-check, sir. Pwede kang banga, sir. Okay, very good. So if the client can't be able to swallow tablets, then we're going to administer the powdered medication. So we're going to mix the powdered medication with liquid at bedside and we're going to give to client to drink. So makatulod na katambal, sir, tablitas. So kaning powdered form, sir, atong gamiton, sir, atong gidabok na tablitas. So ako ni siyang butangan o tubig, sir, 5 ml. Okay. So here's now the liquid form. Nora, sir. Tambal. Okay, very good. Then we're going to caution client against chewing and swallowing lozenges. So kanang lozenges, sir, usa ni siya nga type na tambal, sir, nga dili nimo angay usapon or tunlon, sir, kay if imo usapon na or tunlon, sir, pwede nga niya action, sir, di na mo effect sa imong lawas. And if client is unable to hold the medication, then we're going to gently introduce each drug into his mouth and we must not rush. So for example, okay, and if tablet or capsules falls on the floor, then we're going to repeat the procedure again. So we're going to stay until client has completely swallowed each medication. Then we're going to ask client to open his mouth if uncertain whether each medication has been swallowed. So we already did. Next, for highly acidic medications such as aspirin, so we're going to offer a non-fat snack such as crackers if not contraindicated on the client's condition. Then we're going to assist client in returning to comfortable position. Balik na tagida, sir. Salamat kay sir sa imong cooperation, sir, ug sa imong oras.
Salamat to.
So after that, we're going to dispose soil supplies and washings. And then we're going to return within 30 minutes to evaluate client's response to medication. So after 30 minutes, sir, mabalik lang ko, sir, ha, para i-check ikaw, sir. Ang imong sunod nga tambal, sir, is scheduled unya nga alas 6, sir. So thank you kay sir, ha. Alis ako, sir.
Juice.
And then we're going to ask client or family member to identify medication name and explain purpose, action, dosage schedule, and potential side effects of drugs. So, may buntag, Mother, ikaw ang mama ni Mr. Dan Kelly Morales. Ma'am sa?
Yes, ma'am.
Ito ba?
Ako to, ma'am.
Okay. So, pwede ba na ako evaluate, ma'am, kung unsa tong mga drugs nga akong gipainom sa imong anak, ma'am?
Kuan, ma'am, kanang una tong biogesic nga paracetamol, ikaduha tong captopril o katong panglas kay Bonovil. Oh, Bonovil.
Pero sa may sunod nga schedule, ma'am, sa pagpainom o tambal sa imong anak, ma'am?
Unya na pong alas 6 sa gabi, ma'am, iyang sunod na schedule.
Kabalo ba ka, ma'am, or aware ba ka, ma'am,
Yes,
sa mga
ma'am.
side effects ani, ma'am?
Kanang biogesic or paracetamol, ma'am, pwede siyang makakos og dizziness, drowsiness, constipation o blurred vision, ma'am. Tapos katong captopril, basis akong nadunggan ganina, ma'am, well ka-explain ka, pwede siya makakos og extreme tiredness o dizziness as well as katong sa
Okay,
Bonovil.
very good. So, salamat kayo.
Okay, ma'am, so thank you.
So we should always notify the physician when the client exhibits a toxic effect or allergic reaction or with the onset of the side effects and withhold further doses. And for our reporting and planning, so we're going to record administration of medications and patient chart. Then we're going to place initials or signature on medication sheet opposite the time it was administered. Lastly, we're going to record the reason if any drug is withheld and follow agency's policies for proper recording.